Hello, my name is Logan Heimann. I will be doing the postpartum assessment on a mother. When I walk into the room, I will be washing my hands. I will also have my equipment to do the vital signs. Good evening, my name is Logan Heimann, and I'm your student nurse today. I'll be doing your vital signs along with your bubble H assessment. I'm going to start by getting your temperature. I'll also be checking your blood pressure. And I would count the respirations for a minute, and then from there I would go in and I would say, I'm going to listen to your breath sounds, and I would also have a pulse oximeter in the room due to the Dynamap, and I would just stick it on one of the fingers to get the O2. I'm just going to listen to your lungs here real quick. Listen to the lungs. I'm going to listen to your heart now. And then I'll go to the I get the apical pulse, and I'll listen for a full minute, and that's how I'll get the pulse for the vital signs. Then from there, I will also listen to the bowel sounds. Ma'am, I'm going to lift up your dress here so I can get an assessment of your bowel sounds here real quick. And I'll be listening for any activity. Good news, your bowels are active. And now, since I have your vital signs done, are you in any pain? No? Okay, good. And I have a few other questions before I start doing your bubble H assessment. When was your last bowel movement, and are you passing gas? Your last bowel movement was last night, and you passed gas this morning? Okay, good. When did you last go pee? Okay, an hour ago. Good. And any problems with urination at all? Nope? Okay, good. So with the bubble H assessment, what's going to be happening is that the first one is your breasts. I'm going to ask you a few questions. Do your breasts feel soft, tender? Is there any warmth to them at all? No? Okay. I'm just going to check real quick just to make sure. Just going to roll up your gown here real quick. Breasts are soft, non-tender, and I didn't find any warmth or hard spots in it. And nipples are intact, which is good. Now for the next part. The next part is the U. It's your uterus. What I'm going to be searching for is the fundus, or the top part of the uterus. Oh, feel it right there. Okay. Cool. Okay. So your top part of your uterus is 2 finger widths down from the belly button, and it is firm midline, and 2 finger widths down. From there, it's good that it's firm, because your uterus can be soft, and it can also be non-midline. Midline means in line with your belly button. It could be off over here or off over here. Usually if it's over here, that usually means you have a full bladder and you just need to go pee. If your uterus is soft though, that means you have a higher increase for bleeding. So you want your uterus to be nice and firm, contracted. That cuts off the blood vessels, which helps with getting your uterus back to the normal size and control your bleeding. One way that you can do it is find your fundus, or the top part of your uterus, and then massage it for a minute once an hour. And then from there, so that's your uterus. Now we're going on to the next B. Next B is your bladder. I touched on that a little bit there. So with the bladder, I'm just palpating it. Your bladder's not full. Like you said, you went to the restroom about 2 hours ago, which is good. And you also want to go 2 hours. Usually that's about the norm, especially after you're coming out here with, like, say, postpartum. Just because once the baby's out, your bladder has more room to expand, and sometimes you don't know how full you are, and your bladder will get your bladder will get bigger. The word we use is distended. From there, the next one is bowel. So are you having any tenderness at all on palpation? She was not having any tenderness. Her abdomens are soft. When was your last bowel movement? Okay, good. Last night, like you said earlier. And you passed gas this morning, correct? Good. Do you feel like there's any air in your abdomen at all? No? Okay. So now that the bowels are done, we're going to move on to the L. The L is lochia, which is the bleeding coming out of your vagina currently at the moment. I'll be checking your pad here real quick. When was the last time you changed the pad? About an hour ago? Okay. That's good, actually, because the way we measure the bleeding or the discharge from your vagina, we measure it by hour. So what's going to happen is that when I pull it back and I look at what's on there, it'll be a pretty good measurement of how you're bleeding currently at the moment, or what the discharge you have at the moment. Okay, so definitely red. So you have lochia rubra. Pretty decent size. So it's about finger width. Okay. About yay big by about yay tall. So 2 centimeters, 2 inches wide. So 6 centimeters wide by about 12 centimeters tall. Okay. There was no odor from it. That's good. If you smell an odor coming from the discharge, it can mean possible infection, and that would make it so that your uterus does not contract and return to normal as easy as it could. Also, that's about, say, moderate bleeding for about an hour. So that's not too bad. Just make sure you massage that fundus, and that'll help control that bleeding. As you progress on through the weeks postpartum, it should turn into what we would call serosa, or like a pink, like a brownish color, and then it'll go to alba, which is more kind of a whitish color. And you want the alba, and the alba lasts a few weeks. Okay, so now that that's done, I'm going to go to the E of your bubble H assessment, which is your episiotomy. I'm going to turn you over here real quick. Now I'm going to look down here. Your episiotomy actually looks really good. We use the acronym RETA. You have no redness, edema, ecchymosis, discharge, or and it's well approximated. And your epidural site looks like it's healing up pretty well too. You don't, it doesn't look like you have any hemorrhoids. Did you have any hemorrhoids during pregnancy? No? Okay, good. If the client was had a C-section, we would skip, instead of the episiotomy, we would go the E-incision. So it would be up in here, and we would check and see how well that's healing up and how well it's approximated. When we also check the bowels, we would make sure that they're not having any air in the stomach, or how they're feeling, because if they feel like there's a hardness in their abdomen or if there's air in their stomach, it can be indicative of paralytic ileus. Now moving on, we're going to go to the next part of it, which is the H, the Heimanns. I'm going to toss that in the trash. Can you relax for me? Good. Any pain? No? Good. Okay, now relax your foot, please. Okay. Good. I'm not seeing any redness, swelling, and the patient didn't have any pain upon doing the Heimann sign. And the plantar drop was pretty good too. Plantar dorsiflexion. Now I'm going to check your other leg. Now relax for me. Any pain? No? The other leg, no swelling or redness. I'm not seeing any varicosities either. And relax your foot for me, please. And just let your foot drop. Good. And I wasn't seeing any clonus in the foot during the drop either. So remember about the few of the tips that I told you about? Can you tell me about the fundus? What were you supposed to do for the fundus to help with the bleeding? Yes, that's right. Massage the fundus 1 minute every hour. And then for, say, like the urine, like the bladder, what tip did I give you for that? Yes, that's also right. I gave you a tip about how you should probably void every 2 hours. What I forgot to give you while I was doing the lochia there, or the bleeding, there was 2 tips actually that I wanted to remind you of. The 2 tips are, if it's red, go back to bed. So say everything's going fine, you're not having a lot of discharge, or it's, say, scant or little amount, but then you start doing a lot of stuff and you start bleeding heavily. You want to rest. You're trying to be Supermom. And after having a baby, your body needs to recover. Now, and then the other tip that I want to give you about bleeding is that if you soak 1 pad in 1 hour, you would want to call your physician. 1 call. 1 pad, 1 hour, 1 call. Is that good? Okay. Can you repeat that back to me? Thank you. During the procedure, for the emotional side of things, client was receptive of the treatment, smiled, and was pleasant.